So here's how to actually know if your Achilles tendinopathy is getting better and is responding to load appropriately. In this video, we're going to go over some of the metrics that I use, basically the checkpoint system involved with each client as we start to progress load over time. Many people, when they start loading, they kind of start with body weight calf raises and then they increase the amount they do. They maybe do a heel drop. They maybe do a little bit of weight, 10 pounds with an isometric. Like there's a lot of disjointed approaches and a lot of protocols out there that are all can be good for the right situation, but the overarching angle here is that you need to build more capacity within the tendon, and if you don't know how to progressively overload, that becomes much more difficult. So progressive overload is a strength training concept that is very much or should be used within the rehab setting, because rehab is really just training with some more context or in the presence of pain, but the principles remain the same. The progressive overload principle here maybe takes a little more context because you are in pain and actually understanding what that pain means, so that way you know when to push or when to pull back. Tendons like to live within this little window of load, right? They want enough strain in order to cause adaptation, but too much can send you into a flare or cause more symptoms. So that's where using this system is why it makes it a little more predictable with the rehab process, with the loading process in general. So the first point is, how does it actually feel during the movement? We can talk strictly about calf raises. As you do a calf raise or an isometric hold, how does it feel during? Most cases with Achilles tendinopathy feel pretty good during the motion. The tendon warms up. Maybe the first rep or first set of iso is a little bit uncomfortable, but then it warms up and feels fine. Very common presentation. There will be some people usually that have insertional tendinopathy where if they get too deep into dorsiflexion, it can be pretty painful. And I've also had people that went from doing really no calf raises to a deep drop into dorsiflexion, the heel dropping really far down into a passive stretch, and then trying to push through and load through a full calf raise when they're definitely not ready for it. The intensity at which you do an exercise can determine how it feels during, obviously, just like with any other strength program. Understanding how it feels with your specific symptoms during the movement actually matter. If you have a sharp increase in pain, it's usually one of three things. You have too much load. If you're using weights, cut that down a little bit. You're going through too much of a range of motion, so you probably need to not go through as much range of motion into usually deeper dorsiflexion, especially if you have insertional. And then it could be where you're doing way too much volume, right? Not always the case. Usually it's the load or the range of motion that's the problem. This can be a trap if you feel good during an exercise and you're just like, all right, I'm gonna do 20 more pounds on this isometric or on this eccentric heel raise. So be cautious of that. Just because you feel good during, and this is a newer movement, newer exercise, and you're not sure how you're gonna feel after the next day, that's why we have these other checkpoints in place. The second checkpoint is, how do you feel 2 to 3 hours after? You've loaded it for the day, you did your calf raise, you did some other exercises on top of it, maybe some walking. How does it feel 2 to 3 hours after? If the pain continues to climb and ramp and really get to a high level beyond what your baseline is day to day, maybe need to dial back the intensity of it. But if it goes up and kind of stagnates, that's one where we wait until this next checkpoint to say, how does it recover? Period after loading and into the next day is how well can you recover in between high load sessions? So that 2 to 3 hours after is a good gauge of basically how does the tendon react after a good amount of loading and when you go to pretty much like a resting state. Many people, a little bit of soreness to be expected, right? Or maybe goes back to baseline pain, even sometimes no pain. Next checkpoint, the next day, really matter when it comes to how you can bounce back and recover in between sessions. Most people with Achilles tendinopathy have morning pain and stiffness as soon as they wake up. If they're more active the day before, they go for a run or they play basketball, it's worse in the morning. So as we go through those high load sessions, we use that as feedback. Okay, we did these calf raises, these heavy calf raises the day before. How do we feel next morning? And if your pain is pretty much baseline, that's a win. That's good, right? We didn't overload the tendon to the point where it's just, cranky and flared up. If the pain is much higher, we need to think about what activities did we do the day before. Because if you did the heavy calf raises and you went for a run and then you decided to go for a walk with the family, It's a lot of load in a short amount of time. So we need to change one of those variables. It may not be we need to change the load on the calf raise, but rather what are we doing in conjunction with the calf raises? But maybe we dial back the run a little bit and see how you tolerate that load. So it may seem like a little bit of trial and error, and to an extent it is, but it's more so testing how your body reacts to load, but knowing what variables are actually contributing to the next day symptoms. That's why understanding what you're doing before, hitting these checkpoints, seeing how you feel the next day. If it's baseline pain or less, awesome. If it's a little bit of extra pain, but tolerable, you may need another day to recover before another high load session, and that's okay. We want to make sure we have enough strain on the tendon to cause adaptations, but not too much to the point where you're just constantly flared and you're ping-ponging back and forth. That's just going to keep you stalled in your progress and really just prolong this whole process as a whole. Then you're going to get frustrated. With frustration means we stop other stuff, we try a bunch of other things, hit, shoes, inserts, injections, surgery, when really we just need a system in place to when you know how to push and when to pull back. And then we need to give it time. We need to be consistent. We need to be patient. And those last three things are very hard when it comes to rehab. Very hard when it comes to life, especially nowadays, when there is all these other options of quick fixes, quote unquote. But really having those checkpoints in place, knowing when to progressively overload when it comes to the tendon is extremely important. And that looks a little bit different for everybody. But with this this checkpoint system in place, you at least have an idea of what variables you might need to dial back or dial up to make sure you're getting enough load and to make sure you're not consistently overloading. And it's a delicate balance that we play here. This is something I do with every single client that I work with. So if you jump on a call with me, that's part of what I talk about with loading. Is we need to load strategically, but it's all really hyper specific to how you actually tolerate load. That's why other protocols maybe didn't work for you. The Alfredson, the Berlin method, both valid, right? There's other ones out there that are all valid and work. But if it's not specific enough, then that's where they can fall flat. If there's other things going on at the foot, the hips, the tibia, things like that, that's where these things don't address it. Hopefully this helps as far as like knowing when to pull back, when to push forward. Use this checkpoint system when it comes to your rehab. If you're really curious and stuck and really want to see what this looks like in real time and to really see if this type of treatment will help, if you're curious, you're like, hey, I just need someone to guide me, walk me through a plan that's specific to me, feel free to book a one-on-one call with me. We'll dive into your specific situation to see what actually needs to happen for you to get the result that you're looking for. Because it's context specific, right? There's a lot of information that needs to be pulled out in order to build a plan that makes the most sense for you. So if that's something you're interested in, book a call at the link below. You can also message me on Instagram to manually book with me. Otherwise, like, subscribe, do all the things here on YouTube. Hopefully this helps. See you next time.